Hey
Hey, everybody.
everybody, this is Jamie and Christine. Happy Halloween. We are here to talk to you guys today about avoiding the spooky complications of diabetes. But we're going to give you so many tricks, so many tips, and things to talk about with your doctor or provider so that you can spell your way around not getting these complications. As we get
Exactly.
started today, like we said, we want to talk about some of the most common complications and then how do we prevent them, right? We just don't want to talk about them. That's just giving you half the story. So we've
Exactly.
got 5 different things that we're going to talk about, and we left them in the medical terminology on purpose because these are big, scary words. So we're going to talk about cerebrovascular disease,
Yep.
cardiovascular disease, nephropathy, retinopathy, and neuropathy.
And I wanted to show this picture because it just really gives a good indication of how many different systems in the body diabetes can affect if it's uncontrolled. And this doesn't even list all of them, doesn't even talk about the liver in here. So there's just a lot of complications that can happen. And we're going to go over a few of the major ones today and then how to avoid them. But I wanted to show you guys this picture because it really can wreak havoc on your body.
Yeah, head to toe, diabetes affects everything. So let's talk about the first spooky complication of cerebrovascular disease. Cerebrovascular disease, a huge word. Let's break it down. Vascular, blood vessels. Cerebro, talking about our brain. So
Yep.
we're talking about a blood disorder or a vascular disorder that is in the veins going up to our brain. So like a stroke is what we're talking about.
Right.
Christine, what's a stroke?
Well, there can be a couple different causes of a stroke. So what happens is as we get those extra sugars in our blood vessels, we kind of talked about this with our cholesterol talk. When those blood vessels get a little bit more sticky, so more likely for those plaques and cholesterols to stick onto those vessels. But what can also happen is those extra sugars can kind of act like little razor blades on those blood vessels going to the brain, and that can cause some leakage. And so when you have that happen, I think we have a picture on this next slide here. You can have two different types of strokes. You can have a stroke where there's like a hemorrhage, so those blood vessels leak, and that causes leakage in the brain. Or you can have a stroke where there's like a blood clot and a ischemic stroke. And so what can happen is when you have those clots that are sticking to the side, they can break off and go into those smaller vessels in the brain. And so those are the two complications that can cause a stroke, either the leaking, that bleeding, a hemorrhagic stroke, or that ischemic stroke. And both of those impede blood flow to the brain, which our brain needs, right?
Yeah, and as the brain is the blood flow is blocking the brain, that's going to deplete the oxygen, and that oxygen is absolutely needed, and all those other nutrients that is in the blood. And so you're having brain tissue potentially die off.
Right.
And unfortunately, having diabetes, like you said, causes that sticky blood that we've talked about. And patients with diabetes are 2 to 6 times more susceptible to having, especially that ischemic or that lack of oxygen type of stroke. So it is a scary, scary complication that we absolutely want to avoid. So what can we do?
I just want to mention before that one other thing is those with diabetes, when they have a stroke, they're unfortunately much more likely for that stroke to either lead to death or more serious complications like paralysis. So it's not even an increased risk of having the stroke, but if you have the stroke, you're at much greater increased risk of serious complications from the stroke, which is a big deal.
Yeah.
So, and we're going to go over a theme with all of these today because avoiding the complications for cerebral vascular disease, cardiovascular disease, retinopathy, all of them are the same. One, we want to try to keep those blood sugars under control. We want to maintain good blood pressure. We want to have lower cholesterol. We want to eat healthy foods. We want to exercise. So we're going to go over all those in more detail. But really, all of the treatments or prevention for these are the same all across the board.
Yeah, absolutely. In particular with this cardiovascular or cerebrovascular disease and the cardiovascular one coming up next, we want you to get your cholesterol checked once a year, sometimes twice a year, depending on what's going on.
Right.
And then absolutely at every doctor's visit, getting that blood pressure checked too. So let's
And
talk
if you
about that.
don't smoke, if you don't smoke already, and if you do smoke, quitting smoking, because the combination of smoking and these other factors increases that risk for cardiovascular and cerebrovascular disease even further.
So let's go through that cardiovascular disease. So cardiovascular sounds very similar, but this one's going to be in the heart.
Yeah.
So as we talk about all those blockages of the blood, just like we talked about in the veins or the arteries leading up to the brain, the same thing can happen in your heart. In those very small arteries surrounding the heart, you can get blockages and then they break off and can go into these little small vessels. And that's what's going to cause heart pain, also called angina, and then it can cause the tissue death or a heart attack.
Right. And it can also affect the function of the heart too, where you can get, dysrhythmias or, rapid heart rate, slower heart rate. So it can affect the nerves and the vessels to the heart with having those blockages.
And just like we talked about with the cerebrovascular disease or the risk of stroke, patients with diabetes are twice as likely to have a heart attack as compared to those that don't have diabetes. And so with this, it's controlling the blood sugars. It's getting your cholesterol checked at least once a year and watching and managing those levels, and then the blood pressure as well.
And remember too, the heart is a muscle. So we want to get some good activity for that muscle, right? So the physical activity, the cardiovascular, the resistance exercises, that combination can really help prevent your risk for heart attack as well.
Absolutely. Okay, let's go to the next spooky one. Okay. Nephropathy.
It's another big spooky word, isn't it?
It is. So nephro is going to have to refer to your kidneys. So we're talking about diabetic kidney disease. Christine, break this down for us.
This one is so sneaky because a lot of times until you actually get symptoms, you don't even know it's what's going on or that it's happening. And so, you have blood vessels in your kidneys as well. And as those sugars start to make those blood vessels leak, remember, like they act like little daggers, it can start leaking protein into the urine. And if those blood vessels that, remember, the kidneys help to get everything out of the body, those toxins and so forth. And if those kidneys are leaky, they're not going to be functioning as well. And unfortunately, diabetic kidney disease is one of the leading causes of end-stage renal disease and dialysis. And dialysis, I can tell you guys, it is not something that you want to get to. So there are some ways to check this. And it's a really simple test. Get your urine checked for one. If they're starting to see albumin or protein in the urine, that is the first signs that your kidneys are starting to get affected by your diabetes. And remember, if you're starting to get these, unfortunately, there's not reversal. Once that damage is done, it is done, but you can prevent or slow down the progression. And then obviously you can prevent it from happening if you catch things early on. That's another key that we'll talk about here.
Absolutely. If you've had diabetes, type 2 diabetes, you should be getting this checked every single year. That urine test that Christine talked about, you got to get that tested every single year to start watching that protein, because you've probably had elevated sugars prior to your diagnosis for about 5 to 10 years. If you have type 1 diabetes, you can start getting this checked about 5 years after you're diagnosed, and then getting it annually at that point. And sometimes if you start to show that sugar is in your urine, your doctor may start checking it more than once a year, and they might send you off to the kidney doctor as well.
Sugar and protein.
Yeah.
Yep.
So if we see that you have that protein in your urine, there are some medicines that we now can use that can help really prevent the progression of it, but we can't ever reverse, just like you said. So you can talk with your doctor or your provider about any of those medicines that you may be put on to help the prevention of the progression of this.
Yeah, those SGLT2 inhibitors are one of them that are newer on the market, that not only help with diabetes, but are also, people are using them even if they don't have diabetes, but they have kidney disease because they're showing to be protective.
Yeah. So we want to know, if you guys want to put it in the chat function, when was the last time you had your kidney function checked? A, within the last 6 months, B, within the last year, C, the last 3 years, or D, it's been more than 3 years. Let us know and see if you need to call your doctor.
And it's important that when you're getting these labs done, look at the labs. I mean, a lot of times they'll put them in your portal and you can look. And if you're starting to see that there is this protein in your urine, you want to start acting on it quickly because you do not want to have a kidney transplant or dialysis. That's like your first sign. And what's interesting about this, and we're going to be talking about this next spooky complication, but there has been research to show that if you start seeing protein in your urine, your diabetes is actually starting to affect your eyes, even if you don't realize it. There is a connection between those two.
So that brings us to, good segue, Christine, retinopathy. So retinopathy refers to damage in the retina of our eye. So one, what is the retina?
I mean, to make it simple, it helps you see, right?
It's the very back part of
Yes.
your eyes that has all the nerves that help you see. So just like we were talking about before with diabetes attacking small blood vessels, you have tiny, tiny blood vessels in the very back of our eyes. And with diabetes, you can get blockages back there in the eyes. So one of the things that your body is remarkable, it tries to make, when a small blood vessel gets blocked, it tries to make another way so that it gets nutrients to the part that's blocked. And those new blood vessels in the back of your eye are very fragile and they can break and they can leak a lot easier. So you end up with vision loss because of those breakages in the back of your eye.
Right.
As you continue talking, I'll bring up the spooky little pictures because it can make something as adorable as this start to have those splotches or those floaters kind of in there and kind of block out your vision.
Right.
And slowly those blockages get bigger and then you get complete loss.
Yeah, so it's very important to catch this early. I mean, there is some injections you can do to help slow this progression down, some surgery that are options. But really, the best thing you can do is getting those blood sugars under control. Because if we can prevent those, and the cholesterol and the blood pressure, those are the top three, right?
Yeah, the ABCs of diabetes.
So true.
A1C, blood pressure, cholesterol. And so I think the biggest thing, like you said, is prevention. So it's getting that urine checked. If you've got protein, get yourself to the eye doctor and get a dilated eye exam at least once a year.
Yeah, every year.
Every year. Sometimes if you're under good health, the eye doctor may not say you can skip a year, but you definitely refer to them and try to get that dilated eye exam once a year if it's needed, and sometimes even more. We've had actually eye doctors that have told their patients they have diabetes before they even knew, because they could see the high sugars and the effects of retinopathy early on in those patients. And they've been referred over to our office and we were able to give them help really early. So yes, we have a team of doctors that take care of you. It is definitely a team game.
It really is.
Diabetes. So you don't miss out on any Halloween activities. We want to know, what is your favorite healthy Halloween activity? We've got a pumpkin patch, we've got corn maze, haunted house. or type in something else that you have.
Mhm.
Christine, I'm curious. What is yours?
I'm a big fan of the pumpkin patches with the different activities and apple picking and getting your pumpkins there and just the whole gamut. So, being from Arizona and not having all those seasons, I just love that about fall here.
That's awesome. I will tell you my least favorite is the haunted house.
Hmm.
I
Same, totally the same.
I like pumpkin carving. So I'm going to say
Yeah.
other. I like the pumpkin carving and the seeds that I get to roast and eat
Mhm.
afterwards. So that to me is the favorite thing. So definitely need eyes and vision if I'm going to be cutting into a pumpkin.
Yes,
So last complication that we'll talk about here, but it's actually a big one,
it really
neuropathy.
is.
Neuropathy, when we say neuro, we're talking about nerves.
Mhm.
And I think the most common thing that patients with diabetes will think about with this is loss of feeling in your fingers and toes. But it's really more than that, isn't
Oh,
it?
it is so much more because remember, you also have your autonomic nervous system. That's the nervous system that we don't have to think about. The one that affects our GI system, the one that affects our heart. Those are things, nerves that can be affected too. So some things that you can see with that is hypoglycemic unawareness, meaning that your body can't tell you if you have low blood sugar. Well, that can be a really serious complication because if you're having low blood sugar and your cells are lacking those nutrients, that increases your risk of passing out, having seizures, death. So that's obviously a very scary complication. It can affect the GI system. I saw when I worked in the emergency department, saw people who weren't able to, their GI system just completely shut down because those nerves were not functioning properly. It can affect the bowels and the bladder where you have to self cath because those nerves are affected. It also affects the nerves to the sexual organs. So it can affect, erectile dysfunction and vaginal dryness and all of those. So there's a lot of complications that the nerves that can be affected without not just the fingers and the toes that we don't always think about. And remember, what happens is the same thing. You have blood vessels that supply the nerves to our bodies. You're going to hear this over and over again. Those blood vessels start to get occluded, they get blocked. Those nerves don't get the nutrients, and then those nerves die. And unfortunately, once those nerves are dead, they're dead. You can't regenerate those nerves. So, this is a huge one that you do not want to get to this spot because once you're there, it's really treating the symptoms, treating the problem, treating the pain, but you're not going to be able to reverse that actual nerve loss.
Yeah, we can prevent it from getting worse, but we cannot bring anything back,
Right.
unfortunately. We can't bring anything back from the dead. I went
And I would
scuba.
say the thing I hear the most from my patients that have come to me with uncontrolled diabetes is, I wish I would have done this sooner. I
Mhm.
wish I would have controlled my diabetes sooner before I had my toes amputated, before my vision was lost. Um, it's a great picture, Jamie. So don't wait, you guys. Like, there are so many things that can be done that are easy lifestyle modifications and tips and tricks that we have too, that you can get your diabetes under control without it being a stressful thing, without it being spooky, right?
Absolutely. And we've tried to break things down for you. The last thing for this neuropathy, some of the nerve pain and the loss of feeling in your fingers and toes may show up a little earlier than the autonomic
Mhm.
dysfunction, but it definitely is something to be scared of. But you can do something about it. For neuropathy, you can do something about it every single day by doing a foot check.
Mhm.
Doing a foot check, looking at your feet, looking for changes, looking for sores that aren't healing. If you're seeing something that's not healing or that's getting worse, you got to call the doctor right away.
Right.
Your doctor is going to do an annual foot exam where they're checking how good you feel the bottom of your feet with a monofilament, and they'll check for your pulses as well to see how the blood flow is doing. Those are the easy things to do to monitor for these. The hard things are that prevention. We'll kind of keep going. We want to know how often you examine your feet, but that prevention, how to avoid it. We've given you over the course of the last year and a half since Christine and I have really been going down these lines.
Yep.
So many tips and tricks on how to have healthy eating habits, little switches that you can make in your diet. As simple as, let's see, Christine, what's your latest food swap?
My latest foods, well, you talked about pumpkins and pumpkin seeds. And
Yeah.
I talked about how a diet actually low in magnesium increases your risk of diabetes, because that magnesium actually helps insulin, the function of insulin exiting that pancreas, and also the cells utilizing it. So that's just one example, is trying to eat a diet higher in magnesium.
And then exercise, right? We're putting out videos of different exercises that you can do at your home easily, and modify it based on your exercise needs so that you can get that body moving. And we want you to find something that's enjoyable to you. Don't take the exercise that I enjoy or that Christine enjoys. Do something that you enjoy so that you can get out there 5 times a week and do it. We want about 150 minutes a week of cardio so that we keep that heart, which we've already talked about. It's a muscle. We want to keep it healthy. We also want to keep our muscles strong. So we want to do those 2 bouts of resistance exercise twice a week. So doing 2 different sessions of resistance, and then adding in flexibility so that you're staying mobile and not increasing your risk for a fall.
And Jamie, I want to touch on this first one really quick, that early diagnosis and control, because I believe the ADA recommends testing after 45, but we see a ton of patients who have diabetes way earlier than that. So what are some reasons you should check? One, if you're overweight, if you have high blood pressure, if you have high cholesterol, if you have a family history of diabetes, if you had gestational diabetes, those are all reasons that if you have any of those complications or disease states, you should be getting checked for diabetes much sooner.
And we've already talked about this already once today, but managing that weight, doing what you can through healthy eating habits and exercise to help decrease your weight if you are overweight. And if you're needing a little help in that department, there are now diabetes medications that can help you with weight loss as well. So it's talking with somebody about that. If you're struggling already, you're doing the diet, you're doing the exercise, you may need just a little bit of a boost with one of those medicines to help you out. So we can help you out and talk with that.
And then we go over little tips on how to just naturally increase your metabolism, things you can do throughout the day to help with weight loss that aren't major changes. So that's one thing that Jamie and I are pretty good at with our patients, is giving those little tips and tricks to really help get to a healthy weight with your diabetes.
And we want to, if you are smoking, encourage you to quit smoking. Nicotine, it by itself is really going to be an increase for cardiovascular disease, so heart disease, and all those extra chemicals that are happening with that cigarette smoking can actually increase that risk as well. So if you are smoking, we highly encourage you to talk to somebody about ways to help you quit. And then the ABCs of diabetes. It's blood sugar control. It's blood pressure control, and it's cholesterol. So it's really the ABCs of diabetes that will help you prevent these spooky complications.
And remember, these spooky complications, at first, you can't tell they're happening until when you start getting symptoms. And by that time, you're at that point of there's no return on that. You know, you can't get those nerves back. You can't unclot necessarily those arteries. So it's super, super important to manage these things early on so that you can avoid these spooky complications.
That's all we have for you guys today. We are hoping you have a happy, safe Halloween. We will see you guys in a few weeks. We're coming up in November, and November is Diabetes Awareness Month. It's one of our favorite months out of the year because of Thanksgiving, but also because of Diabetes Awareness Month. So
all right,
thank
everyone.
you guys.
Thank you. Write any questions that you have in the comments. We'd be happy to